I'm Joshua Koshki, and I'm a restorative and aesthetic dentist at Santa Monica Dental Arts in Santa Monica, California. Dental implants are considered now the gold standard because they replace the entire tooth, not just the part that you see. An implant actually replaces the root of the tooth with a small post that's made of titanium that's placed into the jawbone of the patient. Restoratively, we build a tooth on top of that post. That's why they're strong, stable, and feel very similar to natural teeth. From both a functional and aesthetic standpoint, they're the closest thing we have to replacing it with a real tooth. When it comes to dental implants, implants restore chewing strength because they're anchored directly into the patient's jawbone, just like a natural tooth would. They also look and feel very natural, so patients don't have to think twice when they eat or talk or smile. Unlike bridges, which is also another common option that patients go with, implants don't rely on two neighboring teeth to give it support. A lot of the time, those two neighboring teeth also have to be altered, right, to support that bridge. That's why I always lean towards the gold standard of dental implants because it's both strong and a conservative option long term. Implant process is very planned and it's done step by step. We first start with an evaluation and then we take 3D imaging. This way we know exactly what's happening below the surface. We then plan where we want to place the implant and then we plan a day for surgery. Once the implant is surgically placed, we allow time for it to heal. And then once the healing process is over, we're able to place a crown on top of it. So everything is very mapped out, and patients know exactly what the steps are ahead of time. It really allows us to know what the final result is supposed to be before we even begin. So most patients that we have at Santa Monica Dental Arts, they're very surprised by how straightforward and manageable the process feels. A lot of people are good candidates for dental implants, but proper evaluation is very important. We look at things like bone support, the patient's oral health, and the patient's overall health to make sure that implants are the right fit. Advanced imaging helps us plan everything very precisely. And if something needs to be addressed first, we talk through those options together. One of the biggest benefits of implants is that they help keep the patient's jawbone healthy. When a tooth is missing, the bone underneath can slowly shrink over time because it's no longer being used. Implants stimulate the bone, which helps prevent that breakdown of bone. That support helps maintain a healthy bite and overall oral health long term. The best first step to get started is to contact us so we can schedule a consultation. From there, we can understand exactly what's going on and what the patient's goals are. We want to be able to create a clear long term plan that's tailored specifically for the patient. Everything is explained in a very straightforward, supportive way. And the goal is to make the process feel comfortable and not overwhelming. The best way to get started is just contacting us. This way we can just have a open conversation and see if, we're the right fit.